Hello everyone, I'm Dr. Darsh Shah.
And I'm Dr. Altamash Raja.
And welcome to Medicine Redefined,
a podcast where we will explore the often overlooked but necessary components of health, what we consider to be the fundamentals.
We will investigate topics and practices that can give you and your patients the best chance to optimize a healthy lifestyle. It's time to move the needle forward and put the health back in healthcare. Our guest today is the one and only Dr. Omolara Thomas Uwemedimo, who also goes by Dr. O. She's a healthcare founder, social entrepreneurship coach, healthcare practice funding consultant, and growth strategist for women of color in healthcare. Her career as a pediatrician spans for almost 2 decades, and then she's also been a public health researcher and professor for over a decade. Her work is defined by a passion for social justice, serving as an advocate and working as a global physician across sub-Saharan Africa, Asia, and the Caribbean. In 2019, she co-founded Strong Children Wellness, a multi-award-winning healthcare practice network in New York City, which provides integrated physical health, mental health, and social services for minorities and low-income children and families. She also is the founder of Melanin Medicine, a premier social entrepreneurship and funding consulting company, which helps mission-driven practices secure capital without incurring debt or diluting equity to grow their own income streams and social impact. Dr. O is an expert in purpose-led entrepreneurship, securing funding for healthcare, addressing medical racism for marginalized providers and patients, and building socially responsive healthcare spaces. Her work has been featured in People.com, NBC News, Medscape, Essence.com, Newsweek, Crain's, Politico, Reuters, NPR, and more. As you can tell from that introduction, Dr. O is a beast. In this episode, she's going to give us the tools and tactics that we as healthcare providers can use to support people in color. We're also going to learn about her learnings as a global health physician, as she has gone to sub-Saharan Africa, Asia, and the Caribbean. There's a lot to learn this episode, especially if you are a provider. We're also going to touch on how we can use grants so that we can scale our nonprofits. And she's got a lot of cool tips for that many of us don't actually know. All right, without further ado, let's get to it. Here's Dr. O. Dr. O, thank you so much for coming on to the Medicine Redefined podcast. Super excited to have you on here.
Thank you for having me. I am also super excited.
Yeah. So you are a pediatrician, but you are much more than that. From all the podcast episodes I've listened to, and especially your podcast, which by the way is fantastic, having 100 plus episodes and having like good quantity to them too, like 20, 30 minute episodes. I mean, you're putting a lot in there and you're talking about so many diverse things. For someone who wears so many different hats, I'm always interested in learning about how someone cultivates those passions and how they chose to, what I assume is make small bets throughout their career to really see if those passions fit. If you don't mind, take me through a little bit about your journey and kind of how you thought about what you wanted to do when you grew up.
Yeah, I think that is so interesting because I definitely would not have imagined that what I'm doing now is what I would have been doing. I grew up the daughter of immigrants, and so Nigerian immigrants. So I only had one choice, which was to be a doctor.
I feel that pain.
But seriously, I really was attracted to medicine, particularly because of my interaction with my own pediatrician. I was sick a lot with a lot of sinus infections and would see them. And I just really loved the intimacy of that. I remember as a child just loving how connected that was. So medicine definitely was something I wanted to do from very young. However, the space that I think really cemented what it was that I wanted to do within medicine was when I would take trips back to Nigeria. And when I was going there, understanding that my cousins were living a completely different life than me, just due to the fact of where we lived, it started to, I didn't know what the word was, but I realized the word was justice, about why there was a unfairness about life, about medicine, about health, about just many issues. And so I think all of us, it's really important for us to figure out what's that theme that kind of puts it all together. Yes, because what I do looks very disjointed, but I'm always connecting to what the theme is. And so ultimately I ended up going into pediatrics, particularly because of how I got connected to medicine and my love and passion in that. But what I think is really important when we think about journeys is trying to identify and not be afraid of where there's a disconnect in the work that you're
Hmm.
doing. And so when I was doing pediatrics, I think the disconnect happened. I was able to train in Boston at Boston Children's and Boston Medical Center. And during that time, one of the things that got me was in Boston Medical Center in particular, how many of my patients weren't actually that sick. They were actually really well patients, but their social and environmental lives were in complete disarray. And of course, at that place, which was a safety net hospital, it was all of the usual suspects of poverty. So whether that be financial strain, unemployment, even domestic violence, all of these issues that I didn't get taught in medical school on how to navigate that. And so that
Right.
was almost a coming of age where I was learning during residency and also at Boston Medical Center, exposed to kind of how physicians don't have to be in the clinical box. We have this great opportunity to get out
Hmm.
of the four walls. And I saw that with programs like Health for the Homeless, where a physician was leading that, or being able to be a part of Project Teach, which is now not Project Teach, I'm sorry, being able to be a part of what is now Health Leads. And Health Leads is this program where we gave prescriptions for housing, for food, and connected them with navigators to address social determinants. So before all of the social determinants language of
Yeah.
unmet social needs, that was where I was getting exposed to that. But I think the other piece of this work was understanding that justice was an important thing and understanding the social environment was an important thing for health outcomes. And the opportunity of what led me there was being in other countries. And so I had the chance to really get connected to working globally. And as I saw the disparity on display, it told me I needed to move into working in Africa. So after residency, I ended up living in Malawi and working there with
Oh, wow.
HIV infected children and trying to start up programs. Once again, the disconnect. The disconnect was I was providing care, but there was a glass ceiling. So it was kind of like, what needs to change? And it was actually the health system. So I got really involved in health system
Hmm.
strengthening and wanted to come back and do my public health degree so I could do program planning and program development. So that's kind of just the iteration of like how each step through that. And I think ultimately the biggest thing that's gotten me here at this point where now I'm an entrepreneur is that I never was satisfied with what care looked like, what healthcare looked like. I was always like, this can be better. And what thing that hasn't been introduced could I do to make this look better?
Yeah, absolutely. I love the idea of themes, and it's funny you mentioned that because, me being on as a mini influencer on social media, I'll talk about things like motivation. And this year with New Year's resolutions, I scrapped the idea of resolutions, and I said, rather than thinking about habits and things that we form and then we tend to forget within a month, why don't we think about themes in our life, themes for 2023, and actually delve into that? Because with that, you're allowed to explore, right? And I think one of the biggest things from your journey that I'm starting to hear a recurrent theme of is your exploration, is this outreach, is this growth of trying to get new perspective and actually seek out these disconnects and then find a way through, constant navigation through it that, oh wow, there is actually this overarching principle between two different things. And so for me, my two themes this year were health and action. And then I started seeing some other people say, "Oh, it's great because then you can start to pivot." So I do absolutely love that concept of themes that you do bring up.
Yeah.
I do want to ask though, having experience going to Nigeria and Africa and seeing the healthcare system then, and you talk about justice, what were some of those things that kind of opened your eyes when you compared the United States healthcare system and what your family back home might have been going through?
How long do we have? I think the biggest thing, one of the things that's really interesting was how connected working in low income countries was with working in low income communities here in the US, and how one of the things that I think was really interesting working abroad in India, in sub-Saharan Africa, was the ingenuity that had to happen, right? It was like this lack of complacency, because like literally there was no safety net. There was not, it was just this thought of, okay, what could work, right? And a lot of that ingenuity was what had been the breeding ground of some of the programs that I started to implement as an implementation science researcher. I ended up shifting when I got back from Africa and had some personal, like babies and husbands and all of that stuff. I realized I couldn't travel as much, and I started to center into what communities really did I feel like were historically marginalized, had real difficulty. And it was low income communities, definitely, but my immigrant communities, especially my undocumented immigrants, and being able to start to look at, okay, what are the issues? Poor access to care, right? But not just access, poor access, not just geographic access to actual care, but information access, literacy, health literacy, and then the quality of care, right? So even if I got the information and I knew I was sick, and then I was able to get out of my health desert and actually get to care, that even when I was at care, due to either how I look, my, either being in poverty, whatever, that my interactions in the care system would be biased. And all of those three levels existed in low-income communities. They existed in the US, they existed in Sub-Saharan Africa. And those were the things that I said I wanted to center my work on alleviating. And a lot of it had to do with, how do we talk through the structures? How do we think about not only what's happening inside of these interactions, but what is leading people to have the issues that we see, the food insecurity, the housing insecurity. And so a lot of my work now, I decided to move past just working on physical health care and doing a lot of what we call integrated care. How do we in one place address mental health issues and identify social needs and actually effectively address them? And so that's kind of been now the source of my work, both as a practice founder and in terms of helping other people build spaces that can do that in partnership with communities.
Right. Take me through that model of integrated care, right? Because immediately I kind of think of like a multidisciplinary model where you might have different practitioners of different fields seeing one type of disease state. But I'm sensing something like you're talking about something a little bit different, though, where it comes down to different social elements or different elements in care. So if you don't mind, just take me through a little bit about what your approach is with the integrated care model that you have.
So I always think of it, there's a great model called collective impact, and I think it helps feed into this a little bit, where we're looking at what the problem is, right? And so, for example, my immigrant patients, the problem was kind of just the exclusion of them out of the public benefit space, out of like housing, food. And so the thought was, what could different sectors, not just healthcare, what can different sectors do to address these issues? Because as we know, clinical care only accounts for 20% of health outcomes, right? And we're all aware of that now. And so the thought is, if you actually really want to affect health outcomes, you got to get outside of clinical care. And it's social and behavioral issues that actually account for the other 80%. And so what that means for us is, when you think about an integrated care program, my goal is not to put people in the same place. That's co-location. And that's all well and good. Integration means that I'm actually in some way connecting with these people, and all of us are communicating in a way that makes sense. But my integration is not just multiple disciplines, but getting outside of health and bringing housing partners in, housing organizations, bringing in food pantries in, and saying, how can we create this ecosystem where if a patient comes to me or comes to you, they're going to get everything that they need. We're going to be able to screen. We're going to be able to say, oh, they came to that housing, but we were able to screen for unmet medical needs. So now, because of our ecosystem, I'm going to get you in for the first available appointment. For us and Strong Children Wellness, what we decided was to take it a little further and say, you know what? Behavioral health organization, a social service agency, we're actually going to create a medical space in your space, because the people that we need to reach a lot of times don't trust us, or can't get into our spaces, but they come for WIC, they come for SNAP, they come for those things. And so you have more access. So let's just bring clinical care, which is the weakest link, let's bring that into your space.
Yeah.
And that way we can really integrate. And it also allows for healthcare not to always take up so much space as the egocentric, I am the one who can solve health and wellness. When you take
Right.
care out of it and put them in, they now are forced to work with other sectors and really value the importance of all of those sectors.
Man, I love that. This is why I love doing this podcast, right? Like bringing guests like you, where this is something that I guess has been in the back of my mind, but I've never really thought about, like never really put it to the forefront of my mind. And for our recurrent listeners, they'll know that one of the themes of this podcast is guests coming on and breaking boundaries, breaking not just being a physician, but being a physician who can impact other sectors and really get out there and make a difference. But it is interesting because there is that ego attached to, and any doctor that comes in and saying, I'm going to be responsible for this patient's health and I'm going to be the difference maker. But 20%, I mean, it's pretty staggering. I actually did not know that number. Wow. So that definitely changes the way I kind of look at things, and even the way I'll probably approach my patients in terms of asking them certain questions that are more pertained to outside of that clinical setting. Very cool. I am very interested in kind of how you built all this, but I'm going to save that for when we kind of talk about grants and not nonprofits and all. But take me through another one of your organizations called Melanin Medicine. What is that about?
Oh gosh. Okay. So I'm going to get a little personal. So Melanin Medicine, as you may imagine, I'm a bit of an overachiever. So what happened here was that in 2019, I was doing all of the things. I was leading a global health program. I was running 2 interdepartmental research projects. I also was seeing immigrant patients and other historically excluded patients in Queens, New York. And I was teaching public health in our MPH program. And I got burnt out. That was very predictable. And about 6 months later, I lost the ability to walk. I found out that in 2 weeks in the hospital, I finally found out that I had a brain lesion and I had multiple sclerosis. And for the first time, I had to leave my work. And that was crazy. And then the second revelation was that they had to divide my work amongst 5 people. And I realized at that moment, during my 4 months of medical leave, I had to relearn how to walk. I realized that there had been a lot of stress and issues that come up that are uniquely for people of color and definitely for Black women in healthcare. And there was almost this kind of unlearning that I had to do. And as I was going through that, I was also recognizing that the healthcare space, that the structure of what it looks like wasn't conducive to me thriving as much as I could. And this is a really hard subject because we don't recognize that most healthcare systems are geared towards white cisgender men. And in terms of when we do grand rounds, like little things like that, when we, do other, they don't consider kind of the different intersections that other people have, right? And ultimately, when I needed support from the organization that I was in, they weren't able to provide that for me. And I had to make a choice between my health. And so entrepreneurship kind of saved my life in a way. But I also left kicking and screaming. And what I noticed was that there were other people, specifically Black women physicians, who were also struggling, but keeping it silent. And as I created why I created Melanin Medicine was because as I was learning, other women really I think were motivated by my story of leaving and starting something new and wanted support with that. And then as they were hearing about my work-life integration, they're kind of like, we're interested in the entrepreneurship. And I was like, okay, I can share that. And then the issue always was capital. Like, I want to do this, but healthcare is very capital intensive and I want to create my own space. And they were just interested in how I was able to get capital. And so then we started to morph into really supporting women about how to get the capital they need without giving up ownership, without going into debt. And so we became this healthcare funding consultancy. So it was like this um, shift. And that is why the podcast is so layered, because it literally is going through my journey of leaving a place, trying to get balance, then finding entrepreneurship, and then running into the issue of not being able to fund it and learning how to do that innovation. And so now Melanin Medicine has really become this space that we, not just for Black women, but other women of color, and we're opening now to just any community health practices, but really just helping them to secure capital to partner with nonprofits and get funding to actually grow spaces that can really serve under-resourced communities.
Yeah, I love that. I do want to break down that journey a little bit, though, that you said. You used the word unlearning initially. What did you have to unlearn?
Whew, okay, so I think the first thing was my value was not determined by my work. And what I mean by that is that there was a lot of proving that has to go on with people who aren't usually seen in healthcare spaces, right? A lot of thoughts of, okay, I have to be the best, I have to do this, I have to also, do 800 things, I can't say no to this, or someone will think that I'm not capable, right? These are things that not everyone has to do, whether it be men, whether it be, people of color, whether it be disabled. I fit women, disabled, all of those things now. And I think the unlearning was trying to understand that I belonged and that I didn't have to work myself to the bone in order to show my value. I think the other piece of unlearning that was really important for me in healthcare was to remember that nothing can happen if I'm not well. And I think that it prioritizes, you know, the patient at any cost, right? Even the detriment of your body, right? And it doesn't, and you wonder like what kind of weird space is it that you're trying to pour out wellness when you're ill or when you're not well? Like people who are tired, people who are exhausted, people who are burnt out, and they are the source of wellness for other people. And Brene Brown says you can't give what you don't have, right? So how do you not first pour into making sure the environment, the workplace of healthcare is as well as possible in order to feed into better patient care and outcomes?
Yeah, I like that very much. I mean, it's something I think about as a resident. And when you think about improving a residency program, even, right? Like, how do you foster every level so that you can work as a team and work as a unit, but then also allow people to understand their own worth, like you're talking about. So often we see medicine in terms of a hierarchy and a totem pole, and it's so easy to get down on yourself when you get pimped and you miss a question, or you're late for something, or you're trying to just figure out life. And that's tough to do with healthcare because there's so much pressure from so many different people and so many different things. So I think it's very important with what you said about stepping out a little bit,
Yeah.
realizing your worth, realizing what you can give, and if you can't give that, you got to support yourself first.
Yeah, there's one other thing that I think that was really important as well that I didn't mention, which is the assimilation piece. That it's funny because a lot of people talk about diversity, right? But there is no benefit of diversity if you have just me looking like this, but basically not able to bring what my experience and my resources, like look like this, but you have to be like us, right? Instead of me saying, I come with an immigrant perspective, a perspective around having a lived experience in a low income community, all of these things. And I need to bring that into medicine to make it better. But a lot of the pushing is I need to hide those things to excel, quote unquote, in medicine. And that's an unlearning
Right.
that I had to do.
Yeah, that's a really good point, right? And I think that's where that I in the inclusion of diversity and inclusion maybe kind of comes in and takes place. I know that's been more of a trending topic with companies all over the US in terms of really building and fostering that department. So in terms of diversity and inclusion, how do we, aside from a personal growth standpoint and thinking about self-worth, what about those who are like white folks and black folks? How do they support the entire team, the entire community? What's your take on that in terms of maybe some tips? I know we were not going to get a whole, sermon in here or service in here to really do justice. But even just some quick tips that you've seen that may help folks understand, rather than, like you said, just having somebody of color, rather than having them assimilate, shining their strengths so that they can be their best versions to help the team become better.
Yeah, this is really important to me because one of the things that I did while as an attending and even as a resident, but as an attending was trying to create not safe spaces, but freedom spaces, right? And I think that there was an importance of like getting together everyone, but also an importance of like feeling like there was a sense of belonging. And one of the things that we did was create something called the Mentor Program, which was this program that was focused on bringing Black and Latinx residents together to just have spaces to validate like what they were going through. I think a lot of us, like, because in predominantly white spaces, we don't get the chance to like really connect a lot of times, especially in residency, and being able to kind of like see these things and also troubleshoot, but also know there's a place to take it all out and be able to share it. So creating or cultivating those kind of spaces for those that are underrepresented in your organization is extremely important. I think the second thing is taking a really intentional approach around mentorship. I think, gosh, I feel like there's a lot of like it's a numbers game, right? Where you go into a space and there's all of these people, like men or white men or other that are available, right? So it's very easy to find. And if there is an intention placed on people being able to find culturally responsive mentors as well, or developing a mentorship team. So if I needed someone who was a woman, if I needed someone who was Black, how are we able to identify and make sure that we're prioritizing that? And the third thing I would say is the values piece of letting people bring themselves, like we said, but that requires us actually doing the work to assess what is it that is lighting you on fire? Like, what is it that you're really excited to bring to medicine or that you're passionate about? And how can we integrate that in your either residency learning experience, or how can we integrate that in your career? If I know global health is really a passion of mine, but you're saying, well, sorry, you can't do, like, what are the ways that we can bring some of that? Can we create some kind of group that allows for us to access global populations? Can we leverage that? You want people to be able to bring their passion into this space. That is the way that we create really dynamic and innovative healthcare organizations and projects and services.
Yeah, and I've started to see that the best leaders are the ones who can really do that and really bring out the best. And again, I'm talking about residency, but looking at each resident, asking, hey, what are your strengths? And they don't necessarily have to fit within the program, but let's bounce outside of it. Let's connect you to the right people, but let's get diverse, right? And really try to see and hone in on building that perspective that you kind of touched on in the early onset of this episode. So yeah, I totally agree with that. I did want to ask in regards to speaking out. And the reason I bring this up, I kind of have an anecdote here, a little story. When the Black Lives movement was kind of starting up and the whole George Floyd incident happened, I remember on Instagram, I was part of a group with a few members of people who had some prominent following. And in it was a diverse group. We had some Black people in there, we had some white, we had mixed races. And one of the things was this conversation about the white influencers not speaking up or not putting a post up. And then in the conversation, they started to talk about how they felt like if they did, they would be judged possibly in the wrong way. But then they also had this guilt trip that if they didn't post and stayed silent, it would be just as bad as not doing anything. Silence can often be worse than not taking a stand, or that quote that I'm not articulating properly right now, but I think you get what I'm saying. How do you recommend folks navigate possibly that quote unquote vicious cycle when it comes to really speaking out, but then being afraid of possibly saying the wrong thing and then getting that backlash?
Yeah, it's a lot easier than we think. I think, and I realize this as someone who is privileged, whether it be I have different intersections as a Black woman, I'm a doctor, right? Which is like brings a lot of
Hmm.
privilege to me. But the work that I do is focused on people who experience a lot of financial resource strain and historical exclusion. And the way that I've countered that, whether it be racial, whether it be socioeconomic, has been leveraging your privilege to bring their voices to the table. That way, there isn't this like, what am I going to say on behalf of this? It is more of you say so much by taking yourself out of the equation, but becoming the backbone institution to bring those things to light. So, for example, in your situation, of someone, instead of like being able to be like, this is what I feel about this, you know what, I want us to be able to leverage someone else who can talk about what's really going on, and not expecting them to do that, but like I think the more so is being able to just share. They don't have to teach. We can read on our own, we can do that. But if there's something that you think is particularly important that you're feeling confused about, you're feeling like, I don't know, how to say this, I think that being able to find the people who actually are willing to talk about this, willing to share about these things, is an extremely important, valuable action, that speaks much louder than words. And so I've always delegated to that when I'm thinking of solutions, being able to not think of them inside my isolated box, but being able to say, I'd love to have like a panel for us to think about what are the next things that we need to do. And I'll bring in some of my immigrant patients. I'll bring in, other people who are directly affected. And that allows for them to have that conversation, and also for us to come up with things that actually can move the needle because they're coming from
Hmm.
people who are actually affected.
Right. Yeah. Again, it's about having that global perspective and opening up your mind to others and just more perspectives rather than having that I and that ego feel like you have to say something on your own behalf, which,
Yeah.
again, like you said,
And being
isn't
transparent.
truly
Like, I
necessary.
don't know
Right.
exactly what to say in this moment. And, even the community, right? For influencers, like I really want to lean on my community to help me to, figure out I know I want something to change. And I just, what are some of the actions that you guys are doing? What are some of the actions that you think that we should do? We don't have to like make it as hard. Like, we have to be able to come up with the solution.
Yeah. Yeah. Totally. Cool. So let's make a U-turn, kind of go back to your journey and talking about how you started this, right? So as a resident, you already talked about this, how there's not much education in regards to entrepreneurship in medical school. So for me, as somebody who wants to be a future entrepreneur and start my own medical practice, I listen to your podcast. I'm like, wow, these are amazing resources that I can start to learn, about nonprofits and funding and grants. But why don't you take us through, high level at least, how you got everything like running, how you started?
Yeah. Okay. So I started with what pissed me off. Is that helpful first? So I
Yeah.
started with what pissed me off because I knew that that would be a North Star that would keep me through all of the craziness. All of the people who are like, idolizing entrepreneurs, please do not. It is a trek. But starting with like something that angers you, that you're really just like, and I think of this more in the social entrepreneurship world, which is where I sit. But I think it's identifying what is the problem that exists, right? And what is it that you are just always, just every time you see it happening, you're just like frustrated. um and the reason why I say that is because that allows for you to find something, not a problem that just exists, but one that you're proximal to, and one that you really would feel like would make an impact if you were able to figure out how to solve that. And then what I did from there was I started to identify where were the moments of actual effectiveness in when I saw this problem happen. What were some of the themes that I saw actually would show, oh, this is a bright spot. This is how it usually is. But in this case, it got better. And the best thing to do is start to think about your framework for a solution to that problem. So it could be like, for me, it was the fact that I would see a lot of patients with unmet social needs, and I would get frustrated because that would impact how they could take their medicine or how they can, be able to follow the directions that I gave. And I would just get frustrated at the fact that my social worker really couldn't find the things that were needed. And so that helped me to start to say, who knows the answers to these things a lot quicker? The community partners who actually, the social service agencies, how can we get them connected to us? And initially, what that looked like was doing that work to start to identify who has a solution, what do the existing solutions look like, and even for the people who are providing solutions, what is it that they would need? Like, what is it that they still think is a gap? So that way you've seen the problem, you've seen the existing solutions, you think you have an idea of the gap, but you've also interrogated those who are providing the solutions to find out what are the other gaps that maybe you don't see. And then that's when the fun part starts, where you start to say, well, what if X plus Y plus Z? and then the even better part is, okay, is there any way that like revenue can happen? Like, how can we keep this sustainable? And for me, it really was the idea of seeing that people were falling through the cracks, even when we would refer and saying, with my co-founders, what if we just brought physical healthcare to this space? Then there would be a closed loop. There wouldn't be the opportunity to fall through the cracks. But the question, of course, was, well, can that actually make any money like that way? Can we do that in that way? And what we started to realize there was, yeah, we could bill, we could do all of those things in the same place. And actually, we wouldn't even need to market as much. Like, we are in the spaces. And so then you start to kind of figure out what the ecosystem looks like, not only how to solve the problem, but what is the way you can sustain it? What kind of business model can sustain it? And I think the other piece was, for us as an academic researcher, I was very used to begging for money for proposals, like writing proposals, writing grants. And so immediately when I was like, there's no capital, bootstrapping didn't even come to mind. It was like, get money, find other people to fund this. And that was kind of where the social entrepreneurship piece of figuring out the problem, but then also saying that in order for this to be successful, I want to not run this underfunded. And I think a lot of us have this capacity where we're serving underserved populations or under-resourced populations, and we're okay with providing like underfunded solutions. And so I wanted to make sure that I could figure out how to position this and find who were the people who potentially also prioritized this problem and wanted to give money to solve it. And that was and working with a nonprofit was a great way to do that because of the access to grant dollars that they have. So that's kind of...
Gotcha. So speaking of grant dollars, right? Who you talk about getting funding for nonprofits, for people who aren't business savvy and don't understand the nonprofit world, who can get grants? Are these people just who are trying to open up private practices? Do they have to be under a nonprofit?
Yeah.
Take me through that.
Yeah. So most grants, for the most part, are offered to nonprofit 501c3 tax exempt institutions. However, there are business grants that are available. They are much less frequent than the foundation nonprofit philanthropy ecosystem. What there is a model called fiscal sponsorship, we didn't know that's what we were doing, but I was able to research and figure that out. But fiscal sponsorship is a model where entities, either individuals or even smaller nonprofits or places that haven't yet gotten their nonprofit, they can lean on established nonprofits to start implementing their programs And that funding comes to the nonprofit and then gets given to the organization, which we call the subcontracted organization. And so along those lines, I thought that that was only available for nonprofits, but it is available for profits. The goal of that was to bring values-driven, socially minded organizations, whether they're for-profit or non-for-profit, to be able to get access to this kind of funding. And so learning more about that model was how we were able to say, if you have a mission-minded practice, right, where you're serving an underserved population, you need to find a mission-minded nonprofit that is serving the same target population, and you guys can work together, and they would be excited to have health services finally for their patients. And you are excited, hopefully, to have their services available for your patients. And so that was the ecosystem that we created and now teach other people to basically build out, to not only get grant funding, but also to increase access and equity to care, especially for patients that a lot of times we never see in healthcare institutions because of the multiple barriers.
Gotcha. I'm asking this all selfishly because I'm still trying to learn all this. So, when you are talking about contracting kind of underneath a bigger nonprofit, do you have to be at a certain scale with your business, or is that something you kind of do early on? Because I can only imagine you kind of have to be somewhere at least to gain that reputation and also be able to provide services at the level.
Yeah. So actually, when we started, we had nothing. We had an idea on paper. And so it depends, right? It depends
Okay.
on who you're working with. And so we definitely do tell what we do in our practice, I mean, in Melanin Medicine, is we actually search and research which nonprofits are really established, have a history of good funding, as the first places to really connect with, because the way that you're getting that funding, especially if you haven't started, is by the credibility that you're leaning on with your nonprofit partner. So definitely it's a lot harder if you're working with if you're not established and you're working with a nonprofit that doesn't have a track record of getting a lot of funding, then it becomes both of you are kind of on the struggle bus. But if you have, but the goal is to identify a nonprofit partner that is established, that has a good amount of patients, that may have revenue into the millions. And being able to identify where's the gap in what they're providing for their patients, and or I should say clients, they're not patients, but they're clients. Right. And is health services something that they actually want to bring to their clientele? And that way now, that credibility and that largesse that might intimidate you is no longer intimidating because you have something that they actually need.
Right, you're there. That makes sense. Makes a lot of sense. Very cool. I'm trying to see if I have any more questions from that side of things. Is there anything else you wanted to add? I guess I have a question. Any resources that you recommend for people to look at, whether it's for grants or whether it's just to even learn about nonprofits and learning about everything you just talked about?
Yeah, I mean, so first and foremost, definitely would point people to to my podcast, because I've tried my best to get everything as easy as possible in there. We have a lot of different episodes around this, but I think, in terms of seeking grants, we have a whole framework around this, which includes the fact that you have to position your practice as a social enterprise, and what that takes as well, because it's really important for you to not be like, okay, I run a peds practice. It's more about not what you do, but what's the problem you're solving, right? And then the other piece is packaging that into something that you can present to a nonprofit partner, and being able to show them kind of, this is the roadmap on how we can partner together. And then there are pieces of partnering, right? But I think ultimately, to develop the pipeline, one of the big things that I usually do is I always say Grant Watch is a first place, because it's the cheapest place to go to. There are other like larger grant databases, like Instrumental is a new one, but a lot of times it can be difficult. And so one of the things I always recommend is not focusing on the grants, but focusing on the organizations in your state. So when you think about what is the problem, let's say I'm a pediatric pulmonologist. I'm saying this because one of our clients was a pediatric pulmonologist. She, of course, was devastated by asthma, wanted to talk about how she could get more into the community. What we did was we said, okay, asthma, literally asthma, nonprofit, her state. That was like literally the Google search, right, that you could do. And in that, we started to see, okay, these are the nonprofits who focus on asthma, right? And then now we have a database to do this much more rigorously. But one of the things through this, I want to just make it really easy. You can do that. And I like to say focusing in your local community, in your state, because then that allows for you guys to get state funding, which is a lot less competitive than trying to get a national funder, a national foundation. So these are the ways you think about what is the problem, what is your state, who are the nonprofits, start to look there and start to reach out, right? Saying that this is what you're interested in. Don't ever reach out without looking up their stuff though. Like make sure you've identified what the issue is, like that you've noticed and really would love to learn how to support each other. But that's a really important tool to just be able to start to not look so much at grants, but look at who's in your ecosystem that's also taking care of the people that you want to serve.
Got it. Awesome. And we'll definitely link everything, including your podcast, all the resources that you mentioned in our show notes. So make sure to click those for easy access. Dr. O, I want to thank you so much for coming onto this podcast. I do have a few more questions for you for a wrap up, but I just want to say thank you. Having this conversation isn't always easy for people to listen to or even talk about, but I think it's very important, especially as we move on here in the U.S. We see the struggles that we continue to have, the same conversation that we continue to have. So having these discussions, having you come onto our podcast is definitely an honor. So thank you.
Thank you so much. And definitely for any of your, listeners, if let's say you're a practice owner, you're like, oh my gosh, this would be a godsend. We do have like a quick link. So that's bit.ly/Melanin Medicine. And there's like all of the stuff, the podcast, everything there. So, we're active on Instagram and that's like a home base, but we're everywhere. But I think it's hard to identify what to do when you have a mission and a purpose and you're trying to figure out how to actually make it happen. And this was really a really helpful strategy and tool for a lot of people to do that.
Yeah, for sure. Well, hey, you have a lot going on, so I do want to ask, what's next for you? Have you thought about that?
Is it not enough? I don't know. Honestly, like the place that I really want to be at this point is in going back to some of these larger healthcare organizations. I'm really interested in reach. I think the model that we've been building, of course, to help the patients who we're serving, but we're also building it as like a test case of like, this is how healthcare should look. And my goal is to work with our co-founders to get this information out and hopefully develop more pilot projects and have organizations really start to map out how they can do this in their health system, how they can start to get out of the siloed, I always say health begins in communities, not clinics. And so how they can get out of this clinic, this four wall, and really take healthcare to the next level, especially organizations that are serving low income populations where this is so necessary to address all of the needs and not just physical health needs. So I'm really interested about policy. That's the place that I am, and really interested about like working with health systems at this point. And of course, I'm just always coaching my clients and just building that up to get more spaces that are led by people of color. Those are the really big, important things to me right now, professionally.
Yeah, for sure. Well, hey, you are definitely doing important things. Last question for you is, how do we add the health back in healthcare?
Ooh, that's a nice question. I do think that it's important to see the whole person. I feel like there's so many people who go into healthcare, quote unquote, settings and feel so invisible and unseen and unsafe. And I feel like we can't expect people to leave thriving unless we do ask them, not just what medication are you on, what is this, but ask them about their lives right now. What is actually going on with you, and normalizing that? Because even patients will kind of look at you weird and say, whoa, what are you talking about? And I think if we can do that, of letting people bring their whole full selves to the setting and make it easier for them to do that, make it normal for them to do that, I think we'll have a lot more healthier people.
Yeah, totally agree. Well, thank you so much again, Dr. O. It's been a pleasure.
Thank you.
Thank you for tuning in to another episode of Medicine Redefined. And a special thanks to our team for the production of this podcast. Without you, this would not be possible. Shout out to Ethan Ju, Iman Bashiri, and Haritha Yapuri for all the work that you guys do. Now, before you sign off, please remember the important disclaimer that everything in this podcast is for educational purposes only. It does not constitute the practice of medicine, nor should it be construed as medical advice. No physician-patient relationship is formed, and anything discussed in this podcast does not represent the views of our employers. We recommend that you seek the guidance of your personal physician regarding any specific health-related issues. However, if you enjoy the show, please be sure to subscribe, review, and share with anyone who you think will gain value from this as well. And until next time, thank you for listening.